Hi, my name is McCarthy Robinson, and I will be discussing the trend group of telehealth because it's one of the most significant healthcare trends, I believe. Telehealth functions as a key element of the technological transformation in healthcare systems, which has transformed healthcare delivery methods and patient access to care and their overall experience at all geographic levels. So the impact of telehealth on decision making. So it affects local healthcare decisions regarding resource distribution and staff management and patient assessment procedures. Telehealth platforms enable health care providers, in rural and underserved areas to provide specialty care services while shortening, wait times, minimizing emergency room visits. The transition requires healthcare organizations to spend money on broadband infrastructure development and employee training for successful virtual care implementation. COVID-19 pandemic triggered this rapid increase in telehealth adoption throughout the U.S. The pandemic response included both relaxed telehealth rules and expanded payment coverage for Medicare and Medicaid services. Health organizations are currently redesigning their care delivery models to combine traditional and virtual health care services. The federal government's decision about provider licensure and cross-state practice and reimbursement rates requires strong policy advocacy. Telehealth enables worldwide partnerships through its ability to support remote medical diagnosis and infectious disease monitoring and mental health services delivery. The decision-making process at this level requires evaluation of the digital equity alongside cybersecurity measures and cultural acceptance of virtual care among different population groups. So what's the impact on patient access to care? Telehealth has dramatically expanded, patient access by eliminating barriers like transportation, long wait lists, and geographic isolation. Remote visits offer consistent and timely care to patients who have mobility issues or chronic conditions or behavioral health needs. However, digital disparities persist. Patients who are low income, elderly, or rural may not have devices, internet access, or digital literacy, which inadvertently widens healthcare inequities. These access barriers need to be addressed and ensure that telehealth benefits are equally distributed. So the influence, on culture and diversity. So, trust and utilization of telehealth services depend on the cultural and diverse factors. Traditional healing beliefs, together with communication nuances and distrust in technological based systems, lead certain communities to strongly prefer face-to-face care. Telehealth platforms need to integrate language barriers and accessibility for persons with disabilities and cultural competent care practices. Healthcare providers need to identify and solve implicit biases while providing interpreter services and representative provider choices and culturally respectful communication tools. So telehealth has the potential to exclude marginalized populations from its services when it lacks proper consideration of those items discussed. So the role of the DMP prepared nurse. So the DMP prepared nurse serves as the essential professional for advancing telehealth practices in modern, complex healthcare settings. Through their, evidence-based practice, combined with advanced leadership abilities, they can develop, telehealth programs which meet safety standards while maintaining quality and effectiveness. Their scientific expertise enables them to lead implementation by assessing virtual platform outcomes for chronic disease management. These nurses use informatics and technology literacy skills to examine digital health data, which helps them enhance platform usability and operational efficiency. So nurses act as, our ethical guardians who maintain telehealth policies, which safeguard patient privacy while ensuring equal access, healthcare access. So there was in Medical Journal in 2021, there was a systematic review demonstrated that nurse-led telehealth models decreased hospital readmissions while improving chronic disease management and patient satisfaction. So the DNP nurses work to create policy changes through their efforts, which include fighting for equal broadband access and developing institutional guidelines, to integrate telehealth into routine medical practice. So telehealth, in closing and kind of summarizing everything, it really represents more than that technological advancement because it transforms how healthcare services are delivered. The system affects choices at a multi-organizational level while transforming access to care and demanding cultural humility from healthcare providers. Thank you.